So in the context of antibodies, it's very important to recognize one of the biggest advances has been the development of what we call bispecific antibodies, which target two cell surface markers, but also engage T cells. So they have the wonderful term BITE, and these antibodies have been really very exciting, and clinical data on these now is emerging. And whilst they do involve a certain amount of complexity in their administration, they're very effective. Early data shows high qualities of responses, but there are also some side effects. So early days, but certainly the early signals are very encouraging. Now, the antibody drug conjugates that we talked about are very similar to the GSK916 that I talked about earlier. And there's an ability to deliver to a specific target, such as BCMA, an actual cytotoxic. And then you spare tissues that don't express the target, but you actually deliver the cytotoxic to it. Now, GSK916, or as we call it for short, belamaf, is really a very promising antibody in my opinion. There are side effects associated with its use, but they're very manageable. Probably the most important is some ocular toxicity, but again, especially if you divide doses and you reduce dose and you change schedule, again, can prove very manageable. I think when you start to combine GSK916 with other drugs, we're going to see even more excitement because essentially you're able to bring down doses in that context and then synergize with other agents.